By 2050, the world population is expected to reach 9.7 billion, with growth characterized by urban population growth in secondary cities. As populations increase, more people move to the cities to take advantage of job and educational opportunities. Currently, more than 50% of the world's population live in urban areas. Future world population increases are expected to add 3 billion city dwellers by the year 2050. However, infrastructure improvements have not kept pace with rapid urbanization trends. This problem is especially prevalent in low and middle-income countries, particularly in Africa and Asia, which are among the most rapidly urbanizing regions. These settings face considerable challenges in meeting demands for basic services. In fact, 2.7 billion people in the world do not have a proper toilet in their house. 27% of urban dwellers do not have piped water in their house, and many others lack proper solid waste disposal or do not have access to affordable housing. The absence of these services affects the health and well-being of people, mostly children under the age of 5 years, and leads to increased health risks and vulnerability, and poses new challenges for global health, including the control of infectious diseases such as diarrheal diseases. Every day, more than 1,000 children die from preventable diseases, including diarrhea, due to lack of water, sanitation, and hygiene. According to the World Health Organization, diarrhea remains a leading cause of mortality and morbidity. Globally, diarrhea has caused 1.4 million deaths. Children under the age of 5 years are the most affected group, with diarrhea accounting for 1 in 10 childhood deaths. In Senegal, diarrhea is the leading cause of death among children under 5 years of age and responsible for 14% of the disability-adjusted life years in this age group. This visualization will focus on urbanization and its effect on childhood diarrhea and associated risk factors in Mbour, Senegal. With almost half of its population living in urban areas, Senegal is one of the most urbanizing countries in sub-Saharan Africa, with a population of about 15 million people. Senegal's urban population has almost doubled in the last few decades, rising from 23% in 1960 to 43% in 2013, and is expected to increase to almost 60% by 2030. The country is located in the far west of Africa and is separated in the south by the Gambia. The case study focuses specifically on the secondary city of Mbour, the third largest and fastest growing city in Senegal. More than 200,000 people live in the city, which is located in the southwestern part of Senegal, in the region of Thiès, 80 kilometers from Dakar, the capital of the country. Administratively, the city is divided into 25 neighborhoods. The health system of Mbour consists of 1 hospital, 1 health district, and 10 health posts. Exponential population growth in Mbour has been followed by rapid spatial expansion. We note 3 main stages of this spatial expansion. The first stage of growth, between 1926 and 1945, corresponded to the creation of 5 neighborhoods, created by settlers and comprising what is now the historical center of Mbour. The second stage of growth, between 1956 and 1976, corresponded to the creation of the first peripheral neighborhoods of the city. The last stage of growth corresponded to the creation of new peripheral neighborhoods created by the municipality between 1995 and 2009. These are now known as the North and South peripheral neighborhoods. In Mbour, urban growth followed by rapid spatial expansion of the city accounts for strong heterogeneity of socioeconomic and environmental conditions that can affect the transmission of water-related diseases like diarrhea. There is a clear distinction between the old and the new neighborhoods in terms of urban infrastructure and access to basic services like drinking water supply, sanitation, sewage disposal, and garbage collection. The Senegalese water network covers the city disproportionately. Even though a private network connection remains the common source of the city's water supply, the peripheral neighborhoods have less coverage, and the modes of supply vary substantially from one neighborhood to another. Next, we describe water practices that have a high risk of contamination. Traditional modes of water supply persist. Populations without access to the water network use public tap water or untreated and polluted water from traditional wells, which lack sanitation and can cause diarrhea. The city does not have a functional sewage network. The only existing drainage networks, which are no longer functional, are those for stormwater and domestic wastewater. The absence of a sanitation system is well illustrated by the stagnant rainwater points, stagnant wastewater points, seasonal flooding, and solid waste deposits through the street. This situation may pollute the water table used by the population to meet their water requirements and can increase the risk of diarrhea transmission among children. The city is insufficiently served by solid waste collection services. To deepen our analysis, the study adopted a multidisciplinary approach. This included a cross-sectional epidemiological household survey using a tablet-based questionnaire interview, microbial water sampling to check for stored water contamination with Escherichia coli and fecal coliform, and a geographical survey to locate the environmental risk factors at community level, such as solid waste dumping, stagnant wastewater points, flood-prone areas, and stagnant rainwater points in the city. We carried out a cross-sectional epidemiological survey with spatial random sampling between September and October 2016. We randomly sampled 800 households distributed throughout 4 zones of the city. This included 161 households in urban central areas, 327 in pericentral areas, 203 in north peripheral areas, and 109 in south peripheral areas. A 2-stage procedure was used to identify households with children under the age of 5 years. For more details on this process, please refer to the paper. We found that 44.5% of the households visited had at least one child experiencing diarrhea in the 2 weeks preceding the interview. The 2-week point prevalence was 33.9%, with significant differences between zones. The highest prevalence of diarrhea was found among children living in the urban central area with 38.3%, followed by those living in the south peripheral area with 37.2%. The lowest prevalence was observed in the north peripheral area with 26.9%. We also looked at the prevalence within zones, that is, by neighborhood, as shown on the map. In the urban central area, the highest prevalence was observed in the Tefes neighborhood with 57.1% and in the zone residentielle with 54.3%. In the pericentral areas, diarrhea prevalence was highest in Baie-Duc at 57.9%, while in the southern peripheral area, the prevalence was higher in zone Sonatel with 46.1%. Only 58.6% of the households surveyed are connected to the water network, with significant disparities between zones and neighborhoods. This map shows the spatial distribution of households with private tap water at home and households that have access to a water supply outside of the home. Diarrheal prevalence was higher in the neighborhoods with the largest number of contaminated water sources, as was the case in the most densely populated neighborhoods of the city. Bacteriological aspects, that is, water contamination with Escherichia coli and fecal coliform bacteria, are the main drivers of diarrhea in the city. We found that 72% of the study population disposed their wastewater in the street, a practice that can contaminate drinking water sources and increase the risk of diarrhea among children. This practice is common throughout the city, with more than 80% disposing wastewater this way in some neighborhoods. The spatial distribution of the major environmental risk factors overlapped with the distribution of diarrhea prevalence in Mbour. We found that 64% of the households visited used an open plastic bag to store their solid waste. There is a lack of proper solid waste disposal all over the city, another factor that may increase the risk of diarrhea transmission among children. This short video described urbanization trends in the context of secondary cities and its effects on the risk factors associated with childhood diarrhea. The findings from Mbour push us to communicate with policymakers and municipal officials to advocate for attention and action to improve water access, sanitation system coverage, and hygiene behavior including solid waste and wastewater management, all of which contribute to the high prevalence of diarrhoea observed among children in the city. We hope this visualization can serve as a decision support tool for policymakers and municipal officials, and can support spatial and temporal targeting of interventions designed to reduce the risk factors for diarrhoea in the population. The methods and approaches used here might be applicable to other cities in West Africa and beyond.